Hello, my fellow future and curious little rats out there. Welcome to the Lab Rat channel. My name is Squeak. This week I decided to talk about different positions in the laboratory field. I won't go into the education part of it. I'll save that for each specific position. So to start off, there's the phlebotomist. They're the ones that draw the blood, do the nose swabs, the throat swabs, along with other methods of collection for different specimens. They also do all the paperwork, make sure it's filed. They make sure we have the correct diagnosis codes so that we can get paid by insurance companies. They field all the phone calls. They are the face of the lab. They are the workhorses of the lab. Overused, underappreciated. They make on average $12 to $15 an hour. And yeah, we really need to show them more appreciation for everything that they do. Next up from there is the MLA, Medical Laboratory Assistant. They do all the same things that the phlebotomist does, but there's a few extra things that they're allowed to do because they have a medical assistant education to go with their phlebotomy. These extra things are they're allowed to run CLIA waived kit testing. They're allowed to help the technicians and technologists with daily maintenance on the analyzers. They're allowed to put specimens on the analyzers. And that's about the extent of their further abilities in the lab with their education. As I said, $15 to $18 an hour for an MLA. Next up is the MLT, Medical Laboratory Technician. That is what I am. This is a 2-year associate's program. Yes, it is a applied science. By the time you're done with your schooling, you will have your Associates of Applied Science Medical Laboratory Technician. On average, we make $20 to $30 an hour for our program. And we do everything, as I stated in the previous ones, depending on the situation, the facility, and the size of it. But we also release results from the analyzers. We are allowed to do this in most states. There's a few special states. Again, I'll save that for another channel because that's kind of a beef. Next up is the MLS, Medical Laboratory Scientist. This is a bachelor's position. Yes, you have to have your bachelor's degree to be a medical laboratory scientist. They make $30 to $40 an hour, depending on the state. They do everything as stated before in all the other positions, but they have the extra added burden of being supervisors, doing paperwork. Yay for MLTs. We don't get all the paperwork. And there's some more extensive testing that they are allowed to do. Most of that is microbiology field. When you're an MLS, that's when you can start to branch off into more specific fields in the laboratory. You can go into a specific microbiology, you can go into a specific type of blood banking. There's many different branches that you can go into in the laboratory field when you hit that MLS. But next up from the MLS is the Pathologist Assistant. Most people get confused and think that because they're just another assistant, that they would be down there with the MLAs. No, they are more than just another assistant. They have their bachelor's in medical laboratory science. They have to have all of that previous knowledge that we all learn in school. Plus, they have the added classes of Pathology Assistant. Yeah, there's special classes for it because pathology is, once again, a creature unto its own. That's where different body pieces go to be analyzed to see if you have cancer or pathogens or parasites, many different things. And your normal pathologist assistant makes 40 to 50 an hour, as far as I know. That's just what I was able to pull up on Google because I don't know any pathology assistants to ask. Next up from the pathology assistant is your main pathologist, at least as far as I know. There might be a few other steps in there, but just as a basic rundown, the pathologist is an MD or a DO. Yes, they have their doctorate degree. Not only do they go through all the same schooling as a doctor, but again, like the pathology assistant, they have pathologist specific courses that they have to take. So that way they can see the difference between all the different types of cancers and all the different pathogens and parasites and everything else. They're the ones that when we get a really wonky blood slide that we have to make from a complete blood cell count, we send it to them. Because yeah, we do a manual diff in the main lab, but if we've got cells in there that are questionable, we send it on to the pathologist and they can actually tell you what's going on. This is why they have to have their doctorate degree, because they are telling you what your issue is. Or more should I say, they're not telling you, they are telling your primary care physician, your ER doctor, hospitalist, whatever, what's wrong. Without the lab, doctors would just be guessing. So I hope this information was helpful, and next video I will break down each positions a little bit further. So if any of this was helpful or you want to learn more about the laboratory field, hit the like and subscribe, and I'll see you all later. May you have a wonderful week because you choose to make it a wonderful week.